Hi, everyone. Thanks for being here. I'm Jonathan Modi, Lead Communications Officer with Oregon Health Authority. Today, we're providing an update on the COVID-19 pandemic here in Oregon. We're joined by OHA Director Patrick Allen, Dr. Dean Seidlinger, Health Officer and State Epidemiologist, and Oregon Department of Education Director Colt Gill. This is an opportunity for media to ask questions and hear from our experts. This event is for media. Members of the public are encouraged to ask questions during one of our Facebook Live events. Some of you have asked for the ability to record this media availability. We are not offering a recording option. However, we have posted a link to our YouTube channel in the chat of this Zoom where the recording of this availability will be available afterward, and the public can check out that site as well. Today, this availability is scheduled for an hour. So after brief remarks by Director Allen and Dr. Seidlinger, we'll take questions until 2 p.m. And just a reminder that Director Gill is also available to answer questions related to schools. As always, to ask a question, please indicate your news organization next to your name, and then use the raise your hand feature to ask a question, and we will add you to the queue. So with that, I'll hand it over to Director Allen.
Great, thanks. Good afternoon again. I'm Patrick Allen, Director of the Oregon Health Authority. Thanks for joining us today as we mark the lifting of mask requirements in schools and in indoor public settings. Today, we're also releasing Oregon's immediate priorities for the next phase of the pandemic. We call this framework the RISE Plan, Resilience in Support of Equity. This plan outlines the steps Oregon will pursue to monitor COVID-19, shield people at highest risk, reinvigorate our communities, and advance our work to eliminate health inequity. It's a plan we'll continue to develop as we listen to and work with people in local communities. As you heard today, we're joined by Dr. Dean Seidlinger, our state epidemiologist and health officer. He'll provide an update on the current COVID-19 situation as hospitalizations and new cases continue to drop. Also on today's call is Director Colt Gill from the Oregon Department of Education. He'll answer your questions about schools. Before we begin, I just want to note that this is my first news conference in several weeks. As many of you know, I've been out following a fall at my home. I returned to work full-time at OHA on Monday after a planned vacation, and I'm getting the green light from my doctor. I'm feeling a lot better, and I'm returning to a full schedule. I want to thank the emergency response and medical staff who came to my aid and treated me. In addition, I also want to thank those who reached out to me and sent best wishes. I really appreciate it. I especially want to thank all of the OHA staff who continued to steer us through pandemic response as well as a busy legislative session. Now, let's talk about what today means and how we move forward. Today at 11:59 p.m., masks will no longer be required indoors in public places and in schools. That's a watershed moment in this pandemic. It's a direct result of the actions Oregonians have taken over the past 2 years, getting vaccinated, wearing masks, and limiting social gatherings during COVID-19 surges. The rate at which Oregonians have taken these steps far exceeds national averages. As a result, we estimate Oregonians have saved approximately 5,700 lives. That's based on a projection of the additional deaths we could have recorded in our state if our death rate was the same as the national average. That's an extraordinary testament to the impact so many of you have had in looking out for each other and reducing the spread of COVID-19. Today is also a turning point. At this time, with Omicron waning and so few Oregonians susceptible to new infections, we can close the emergency phase of Oregon's COVID-19 response and open a new one. In this new phase, our goal is to strengthen health resilience in our communities, not just to tackle COVID-19, but also to address long-standing health inequities and other challenges. Oregon's top priority will be to support the capacity of the communities that have been hardest hit by COVID-19, communities of color and tribal communities. Before the pandemic, systemic racism and oppression fueled unfair health inequities that have shortened lives for many people and burdened communities of color and tribal communities with trauma, higher rates of chronic disease, and other conditions. The COVID-19 pandemic only intensified and worsened these unfair and systemic health inequities. But this new phase means OHA and other state agencies need to play a different role than the one we have played through the first 2 years of the pandemic. It means we can scale back the broad policy interventions and supply efforts COVID-19 initially demanded, and focus on people and communities most harmed during the pandemic, as well as people who continue to be most vulnerable to COVID-19. Our job will be to listen to local priorities. Our role will be to support local efforts. Our role will be to support local efforts to build resilience and improve health equity. Our goal will be to help local healthcare providers, public health officials, and nonprofits work together to address all the barriers to good health their communities face. The RISE plan describes 5 immediate priorities to strengthen local resilience and speed our statewide recovery from the COVID-19 pandemic. These priorities are to protect communities that have been hardest hit by COVID-19, protect people who are most vulnerable to COVID-19, expand access to vital healthcare and support a thriving workforce, keep schools safe for students, staff, and families, and help students recover instructional time, and restore social cohesion by listening to and supporting the priorities of local communities and the steps people take to protect themselves and others. Here are some of the highlights of our new or ongoing efforts to strengthen community resilience. Oregon will continue to test wastewater samples from more than 40 communities to track disease spread and the presence of variants. We'll maintain capacity to administer more than 25,000 COVID-19 vaccine doses per day. We'll supply providers enough courses of COVID-19 therapeutics to treat more than 1,400 people at risk of severe illness per week. We'll maintain testing supplies and laboratory capacity to perform a baseline of 130,000 COVID-19 tests per week in the event we face a resurgence in demand. We'll maintain or expand health coverage to as many as 350,000 people. We'll begin distributing $200 million in workforce development grants to benefit students, apprentices, and adults seeking more competitive skills. We'll continue to hold listening sessions to hear from communities of color and tribal communities, local public health officials, and people in rural communities to hear how we can support local priorities more effectively. COVID-19 changed our world, our nation, our state, and each one of us personally. For Oregon, the pandemic brought to light the strength of our character and our willingness to sacrifice and care for each other. We saved lives. But the pandemic also displayed the shortcomings of government agencies and our healthcare system to care for everyone equitably. And it revealed the fault lines of distrust within our communities. Moving forward, we can enhance our resilience against COVID-19 with our shared commitment to make Oregon a better place for our families and each other. We don't know what the end of the pandemic will bring, but we do know that together, Oregon will rise. And with that, let me turn it over to Dr. Seidlinger.
Thank you, Director Allen. We're going to pause for a few minutes while we switch over an interpreter.
Dean, I think you're good to go.
Thank you, Director Allen. Welcome back. I'd like to begin today by offering my profound thanks for the shared sacrifice and diligence Oregonians have shown throughout the course of the pandemic. 3 months ago, we came before you with a dire warning about the coming Omicron threat, with projected COVID-19 related hospitalizations beyond anything we had previously experienced. Initial projections called for more than 2,000 hospitalizations if Omicron was left unchecked. Oregonians heeded that warning. You stepped up, as so often has happened throughout the pandemic. You got vaccinated and boosted, you wore masks, and you changed your gatherings. Omicron proved to be no match for your resilience and resolve. Our hospitals are no longer imperiled. The data indicates that the spread of COVID-19 in Oregon has tapered dramatically, and conditions now support formally lifting the general mask requirements for indoor settings and in schools starting tomorrow. COVID-19 related hospitalizations have declined at a dizzying rate in recent weeks, far outpacing our projections, and have returned to levels we experienced in late summer before the Delta and Omicron surges. At the Omicron peak, there were 1,130 COVID-19 patients in Oregon's hospitals. Since then, daily hospitalizations have fallen by 77%. Since March 1st, we have shed 199 daily hospitalizations. The most recent model from our partners at OHSU predicted that hospitalizations would fall below 200 around the end of March. Today, OHA is reporting 261 COVID-19 related hospitalizations. Daily reported infections have also fallen dramatically in recent weeks. The current 7-day average of 520 daily cases is 94% lower than the peak of 8,209 cases on January 20th. This is the lowest 7-day average since July. While the recent data is incredibly encouraging, it's important to understand that the pandemic is not yet over. We will continue to see new cases of disease, and we fully expect new variants to emerge. But we believe the firewall of immunity we currently have will keep the virus at bay. More than 80% of Oregonians now have protection against severe illness, whether by vaccination or following recovery from a recent infection. For those reasons, it is now safe to lift the restrictions we've lived under for most of the past 2 years. For OHA and the state, this means transitioning into a supporting role for personal and local decision-making. This is consistent with the way Oregon's public health system is designed to function. Lifting the mask requirements will no doubt come as welcome news for many. For others, it means more anxiety for their own health or the health of those around them. But there will still be requirements in certain settings. Masks will still be required in healthcare settings. This is necessary to protect our providers and the vulnerable patients they serve. Federal mask requirements are still in place for public transportation and other specialized settings. OHA continues recommending mask wearing for some people, including people who are unvaccinated, those who are immunocompromised, those at higher risk for complications, those who are 65 or older, those who live with someone in one of those categories, and this is especially important in communities with higher levels of disease. Universal masking as a primary protective measure is effective in schools, and we recommend this as part of a layered protective measure in communities with high levels of spread. For some people, wearing a mask may provide an added sense of security, and that is totally fine. We should respect everyone's decision. Mask wearing in many countries was common before the start of the pandemic. My hope is that it becomes an unremarkable occurrence here in Oregon. As someone who chooses to wear a jacket or carry an umbrella on a rainy day, they may choose to wear a mask during flu season. We have finally gained an upper hand against COVID-19, but there are steps we can take to keep the virus at bay. Get vaccinated or get a booster shot as soon as you're eligible. Vaccination continues to provide the best protection against severe illness from COVID-19 and its variants. Wear a mask when appropriate. The CDC has issued new guidance for mask wearing for indoor settings that is reflective of the level of transmission in our communities. Stay home if you're sick with COVID-19. Isolate for 5 days, then wear a mask when you're around others for the 5 days following. If you're at higher risk for severe disease, get tested if you have symptoms. Through the course of the pandemic, we acted swiftly to implement measures intended to choke off the virus. We made changes to respond to the situation in front of us with the tools we have available. Oregonians were overwhelmingly supportive, and as a result, our state avoided some of the most serious impacts experienced in other parts of the United States. Here's where Oregon ranks in some key pandemic measures against other states in the District of Columbia. We've had the 3rd lowest per capita case rate and 7th lowest death rate. We're 12th in the percentage of the population that's fully vaccinated and 9th in the percentage of the population that has received a booster shot. We're 10th in the percentage of eligible residents who've received a booster shot and 18th in the percentage of residents who are fully vaccinated. Oregon has consistently ranked near the top in mask wearing according to surveys, even as participation dwindled in other states. Again, thank you. Last summer, we found ourselves in a similar position. to radically change our approach to fighting COVID in the face of lower disease rates. Then we had to confront new variants. This time feels different because it is different. We have higher levels of immunity. We have additional treatments. We continue to monitor changes in the virus and do not see any emerging variants on the horizon. I want to acknowledge everyone who lost a loved one to the virus and to those who were ill or cared for someone who was ill. I grieve with you. Many of us are anxious about these changes. Let's continue to support each other as we move forward. I want to conclude today by saying a heartfelt thank you to my public health colleagues, our health professionals and community partners who fought off fatigue, emotional exhaustion, and attrition to keep Oregonians healthy. Thank you. Now we can take your questions.
Thank you, Dr. Seidlinger and Director Allen. Again, to ask a question, please indicate your news organization next to your name and then use the raise your hand feature and we'll add you to the queue, or you can just toss a question into the chat. Our first question comes from Tim Gruber with Albany Democrat Herald. Go ahead, Tim.
Yeah, so my question is, I know that hospitalization and death have been the primary concerns during the pandemic for the OHA, but with the lifting of the mask mandate in both settings, what are OHA's concerns about long COVID and really excruciating disabilities for people who may be infected and experiencing symptoms indefinitely, as we've seen around the world?
Thank you for that question. This is Dean Seidlinger. I would say my concerns around long COVID are similar to my concerns around hospitalizations and death. We don't know the full extent of who suffers long-term consequences, but we know it's a fair amount of people who've recovered. That goes across ages, from young to old, males and females, those who spent time in the hospital and those who've had more mild illness. Our clinical and academic partners are setting up programs to learn more about the symptoms of COVID-19, effective treatments that can relieve those symptoms and help people recover faster. So, we continue to partner with those academic and clinical partners so that people can receive the care they need, so that even those who've recovered from the acute phase of the illness can receive better treatment to recover from the long-term impacts of COVID, so that we can move beyond this acute phase of response to the virus.
Thank you, Tim. Next question comes from Mike Benner with KGW. Go ahead, Mike.
Thank you, Jonathan. Again, Mike Benner with KGW News. My question is for Colt Gill. Obviously, Colt, so many people are thrilled to be getting the masks off in school. Some won't be able to get them off fast enough, but there are others who are extremely anxious. In fact, today there was a bunch of students protesting the lifting of the mask mandate outside of PPS headquarters in North Portland. They think this is irresponsible, inconsiderate to so many people in the population. What's your message to the folks that have this anxiety going into Monday?
Yeah, thanks for that question. So first, I want to be clear that what's been lifted is the state requirement. Local school districts can still make a decision about local masking requirements, and some are doing that. We're seeing some that are extending the date out a little bit further beyond spring break. Others are still in the decision-making mode. Our districts are using the COVID-19 community levels tool that now shows most of Oregon's counties in the low level of community levels, and suggests from the CDC that it is a time where it's safe for people to go without masks. I think part of the challenge that we have is helping everyone catch up to where the science is at right now and where Oregon is at in terms of the high levels of immunization that we're currently experiencing due to vaccination and due to recently having COVID-19. We released a toolkit, a communication toolkit to school districts across the state of Oregon today to help them communicate the masking requirements that they may develop locally. and to ensure that their schools are always safe, welcoming places for any student who chooses to continue to wear a mask for their own reasons or for reasons aligned to their family. And this can be because they or a family member are immunocompromised, unvaccinated, at greater risk from COVID-19, or that it may be that they live with older family members that are at greater risk as well. So we want a clear message out there that when schools make masks optional, optional means optional, and that any student who chooses to continue or staff member that chooses to continue to wear a mask should be able to do so. And we have, again, a number of messages that we're pushing out that we can share with you.
Thanks, Mike. Next question comes from Angelina Dixon with KVAL, and she wrote her questions in the chat. Her first question is, how will OHA report community wastewater tests? And does Oregon's current vaccine stockpile have any issues with expirations?
Thank you for those questions. In Oregon, we currently partner with Oregon State University on our wastewater surveillance and our wastewater testing. The results from that surveillance are posted on a website so that we can track variants and what's detected in wastewater across about 40 communities in Oregon, and that practice will continue going forward. As far as vaccine expirations, we do know that we have some vaccines in the system that will be expiring shortly, and we're encouraging providers to use those vaccines first so that no vaccines go to waste. But we also want to ensure that there's an adequate supply of vaccines across the state, so that if an individual wants a vaccine, whether it's a first dose, a second dose, or a booster dose, that they have access to that vaccine across their community, and we'll continue our efforts to get those vaccines to people in the communities where they live and get their questions answered so that we know that we can utilize this effective tool in combating this virus going forward.
Thanks for that question, Angelina. Next question comes in the chat from Kelsey McGee with News Channel 21. She asks, does this make you more nervous scaling back?
I will say, go ahead, Director Allen.
Well, I was just going to quickly say I've been nervous for 2.5 years. You know, and I think that's kind of part of our job at the Health Authority and in public health is to be concerned and be nervous about what's coming next. I think, you know, I think as Dr. Seidlinger indicated, all of the indicators right now are good. The trends are down. They continue to be down pretty sharply. We don't seem to see the same, or we've not yet seen the tailing off in decreases, but you know that we would expect to see those in the next couple of weeks or so, I would expect. And there's just not as much COVID out there in the community by a long way than that there was, you know, back in January. But you know, you worry about emerging variants. You worry about you know, different kinds of circumstances coming up. You know, and I think that's a part of the key of the RISE program is to really think about how we focus on communities that have been disproportionately impacted by COVID, communities and individuals that are most at risk, and I think channel our nervousness into how to continue to do a better job protecting those vulnerable individuals from the circumstances that exist now as well as future developments. Dean, do you want to add to that?
No, I want to share that I think, you know, in public health at OHA, you know, we want to try to be prepared for what could be coming towards us. We want to prepare for the worst, hope for the best. We want to prepare individuals and communities to best face whatever comes at us with COVID-19. You know, we need to be prepared to step up our efforts in the future if a more serious variant comes towards us that's causing more hospitalizations. We don't install a smoke detector in our house while the fire is burning. You know, we don't leave the house in the middle of a rainstorm without a raincoat or an umbrella. We need to have some of these measures handy so that if the situation changes, if something more worrisome comes on board, that we are prepared to implement those, whether it's initially with seniors and those most vulnerable who we would ask to take some additional steps because the situation's getting worse. Whether it's particular settings, we change our approach because more vulnerable individuals are served there, or if things get much worse, talking about utilizing masks or other new tools that we may have to face that virus. But for now, with cases continuing to decline, immunity levels at the level where they are, and what we see on the worldwide stage, this is the time to start dialing back on some of these measures. This is the time for individuals to get back some of those face-to-face interactions that they've missed. And this is the time for us to continue to monitor the viral situation and continue to work to provide information to our communities, strengthen our relationships, and go forward together.
Thanks, Kelsey. Next question comes from Lynn Terry with Capital Chronicle. Go ahead, Lynn.
Thank you. Welcome back, Pat. So just to follow, I actually have a question about insurance, but there was kind of a previous question that something was unanswered. When you said, Dean, that there were some vaccines that are expiring, can you put a number on that? And then I'll get to my real question.
Lynn, I can't put a number to that, but I'll ask our communications folks to try and get a number of when we might have some potential vaccines expiring and get that back to y'all.
Okay, so this is probably for Pat. I'm curious about this 350,000 people who are going, in your program are going to be insured. You know, who are those people? Are they people that you're thinking are falling off Medicaid, and that's, you know, they're going to be put on the bridge plan? Are the people who are not insured now? You know, where's the money coming from? Is it money that was approved during the last session? I'd like details about that if you would. Thank you.
Sure, thanks, Lynn. This really is the population that the bridge plan that the legislature approved is aimed at. We've added about that many people to the Oregon Health Plan since the beginning of the pandemic. And we know that many of these people either remain eligible for the Oregon Health Plan or are barely not eligible. And we know that we have a history of people churning on and off the Oregon Health Plan. And we know this isn't good for individuals' health. And we know it's not good for the state just from a budget standpoint. People tend to come on when they're sick and go off when they're not. And what we really do is we've got a process that's a little bit oriented toward sending out documentation for people to fill out, and people, you know, to oversimplify it a little bit, lose their healthcare coverage because they don't read their mail. And what we really want to do is avoid that and make sure that people get the coverage that they're eligible for, whether it's to remain on the Oregon Health Plan or move to the bridge plan if they're eligible for that, move into individual policies ultimately in the individual marketplace. And it's really the notion of how do we make sure that people stay covered, because we know coverage isn't an end in and of itself. It provides a connection to the healthcare system. Coverage leads to having a primary care relationship. Primary care in a pandemic means you've got access to testing, to vaccinations, to therapeutics, to supports for effective isolation and quarantine. And so we really want to not lose ground as we go through this redetermination process that'll eventually happen with the growth in the Oregon Health Plan.
Can I just follow though, you know, during the sessions with Jeremy Van Hay during the legislature, you know, he mentioned the 300,000 figure of those are likely to fall off, as you said, but only a fraction of those people, he said only a fraction would probably qualify for the 138 to 200% of the federal poverty level. So has the thinking changed on the numbers? I'm surprised by the number.
Yeah, so I think without trying to drill too far into the numbers and get out over my skis, I think what you'll find if you look at the 300 or 350,000 people who've been added to the health plan, a portion will continue to be eligible for the Oregon Health Plan. A portion will continue to be, or will be eligible for the bridge plan. A portion will be able to pursue subsidized plans in the on the health insurance marketplace, and some will have turned out to have gotten health insurance by some other means through an employer or having become old enough to qualify for Medicare or those kinds of things. Again, I don't want to try to sort that into specific numbers by category, but I think that's the notion, is making sure that everyone gets to the place where they are covered by whatever they're eligible for. The bridge plan will be an important piece of that, but as you observe, for sure, it's not going to be not going to cover all 350,000 of those people.
Thanks, Lynn. Next question comes from KTVZ. there were businesses and people that were not happy with the masks or mask mandates. Does dropping the mandate really change anything?
Go ahead, Dean.
No, with the mask requirement in Oregon, we know is not universally loved by everyone. It's probably not universally loved by anyone. No one likes wearing their mask. But what surveys have shown time and time again is that Oregonians continue to wear masks at very high levels, especially in the face of new variants, more severe disease arriving in the state. Oregonians took steps to protect themselves and their families, and businesses took steps to continue requiring masks of their employees and the customers and clients that they served. Oregonians made these sacrifices in great numbers and got vaccinated in higher numbers than most other states. And that really did help contribute to blunting the peak of hospitalizations here in Oregon. Yes, some of the initial projections were high based on data from other countries that was adjusted. But as we continued to adjust that peak down of what we expected, it really was due to the changes that Oregonians were making in the face of the Omicron surge, changing their gatherings, postponing plans with friends, wearing masks when they're out in public, and getting vaccinated and boosted so that they were up to date with their vaccines. So while there are some businesses and some individuals who are very unhappy and may have stopped wearing their masks before today, we know that the vast majority of Oregonians continue to wear masks. The vast majority of businesses continue to have only people with masks in them. That will change starting next week, and I think we'll see a mix, and we need to support each other as we make those choices.
Thank you. I saw that Christian Fodenvincel with OPB had his hand up earlier and then lowered it. Christian, did you want to ask a question?
No, somebody answered my question for me, so thanks. I just wanted to hear what Colt Gill had to say about education. Somebody asked that. Thanks.
No problem. Next question comes from Ben Botkin with the Lund Report. Go ahead, Ben.
Thank you. I was hoping you could speak to what types of infrastructure have been built up that can be used for future public health crises unrelated to COVID. Just kind of looking for some high-level examples. Thank you.
So this is Dean Todlinger. I'll start with a few and then turn it over to Director Allen if he wants to elaborate. I think, the people we have at the table are different as we sit here in March of 2022 compared to March of 2020. Engaging different voices from the community about needs, what they're seeing in their community and what might be needed. We have direct contracts with well over 100 community-based organizations that alongside our local and tribal public health partners are serving the needs of people with COVID, linking them up to resources to help them pay rent, get food, stay home while they recover from the illness, support individuals who were still required to quarantine. Those partnerships will continue, a broader public health system working together to meet communities where they are, address their needs, link them to resources that they need. Those actions will continue. Director Allen, is there something you'd like to add?
Yeah, thanks. Dr. Seidlinger did a good job of talking about a lot of the human capacity that we want to continue to dwell on. We've also got hard infrastructure that's out there. We've expanded the testing capacity at our academic testing labs around the state. We've invested in a field operations section that includes mobile testing units and those kinds of hard infrastructure. And there are more of those kinds of investments in stuff that I think we'll continue to be able to have and use to be able to focus on future issues. One great example I can think of is the partnership with Oregon State that we talked about earlier on wastewater testing. That testing can be used to look for signals of other diseases that might not be showing up clinically, but may be present in a community and that we want to be able to know about. I've been in a couple of meetings already where we've had conversations about how we might be able to expand that use. So I think there are a lot of investments, Ben, as you observe, that have been made during the pandemic that we should be able to apply to other circumstances.
Thanks, Ben. Follow-up question from Angelina Dixon with KBAL. With the mask mandate lifting, is the governor's office no longer using large-scale restrictions? to mitigate the virus spread? And for schools, will there be any changes in the state's test to stay policy with the mask mandate lifting?
So let me tackle the first one and say that, yeah, I think that's generally right, that we've moved away from, with these changes, moved away from statewide regulations and requirements, and returned to the way we've controlled communicable disease for more than a century in the state, which is dealing with outbreaks as they occur in usually narrower geographic areas. That could certainly change. We could end up with a new variant or other new circumstances that create a statewide threat to things like healthcare capacity that could cause a return potentially to larger scale regulations. But right now we're really entering a phase where we're focusing on communities most impacted by the pandemic and by those who are most vulnerable to COVID, as we outlined in the RISE plan.
Thank you, Director Allen. I will just build on that. We do still maintain a few statewide tools, our mask requirement in healthcare settings, knowing that this is where individuals with COVID, with symptoms of COVID, go to get care. It's also where the most vulnerable individuals who have underlying conditions, are older Oregonians, either live or get care, and we want to provide that additional layer of protection. As it comes to schools, I'll transition into test to stay, but that's another place where statewide we have resources available to support testing in schools, whether that's screening testing of staff and students on a weekly basis, utilizing our academic labs and commercial labs in the state, or rapid tests available on site or to deliver home to students for students to use if they have symptoms. Those will continue. The resources that were devoted to test to stay will be redeployed. We'll use those to make sure that individuals who are exposed to someone with COVID, who are more at risk for disease, have access to testing and can get that testing at school so they can determine if it looks like they have COVID or potentially something else. We will distribute tests to individuals from some of the lowest income schools so that they have those on hand to be able to test around spring break. We will have tests available for students with disabilities who may be more at risk for COVID-19, who can test on a more frequent basis, as this was available to them previously in the pandemic. We want to ensure that parents who want their children to continue in those programs can continue to access those tests. So while test to stay as it existed won't be there, those tests and other resources to support students, keeping them safely in school in front of teachers will remain. I'm not sure if Director Gale wants to add anything to that.
Thanks, Dr. Seidlinger. I think you actually covered it all. I will, though, provide a resource to the reporters in the room here that we put out earlier this week in partnership with the Oregon Health Authority that does speak to the changes in the test to stay protocol as an enhanced exposure testing, does speak to what Dr. Seidlinger talked about of distributing home tests to schools that serve large numbers of families navigating poverty. So I'll share that with you just momentarily.
Thanks, Director Gill. Thanks, Angelina. Follow-up question from Kelsey McGee. She asks, it was mentioned that OHA will be more inclusive. Why wasn't that already an expectation or standard OHA should be living by?
Yeah, let me tackle that. And I think it's a great call out. And I would say that was an expectation that we had, that the pandemic helped demonstrate the ways that we were failing to live up to that expectation. I think that what we've done coming out of the pandemic is engage differently with those communities in a much more meaningful way, trying to get to the front end of problems rather than do sort of a typical take a plan out to people and say, what do you think? And maybe or maybe not incorporate changes, and really hold ourselves accountable to making a difference in those communities. I would use it as an example of the fact that we've narrowed the vaccine equity gap over the course of the pandemic. We started out nearly a year ago with just huge gaps between communities of color and the white population in the state in rates of vaccination. And we've been able, through a variety of different approaches to how we ordinarily do this work, to significantly close those gaps to the point that, for example, for Black Oregonians of all ages, the vaccination rate is actually higher than for the white population. And the reductions in the gap have been significant across all populations.
Thanks, Kelsey. Next question comes from Lisa Balick with COIN. Go ahead, Lisa.
Yes, thank you. You mentioned about getting tests out to students, and the state spent millions of dollars buying rapid tests and stockpiling them. There were about 2 million of those tests on hand, stockpiled as of last month. Does the state plan to get these out to the public before they expire? In other words, to avoid wasting a lot of money?
Yes, so the tests that we bought at the beginning of this year were designed to get us through a 6-month period. We had some initial tests that went out to healthcare settings, particularly our hospitals, support testing of employees that were kind of budgeted out, for lack of a better term, over about 3 months. But then the other tests that were ordered are designed to support our community partners and schools over about a 6-month period so that we could have testing available to individuals who need it, who are not accessing testing through other systems or weren't able to get tests themselves. So we anticipate being able to distribute all these tests and have them used by individuals in response to the pandemic in front of us.
Thanks, Lisa. That is all the questions we have right now. Again, to ask a question, please indicate your news organization next to your name and then use the raise your hand feature, and we'll add you to the queue. And you're also welcome to drop a question into the chat. Just wait a moment, see if we have any other questions.
Fedor's got a question.
Oh, Fedor. Fedor from the Oregonian. Go ahead, Fedor.
Hi, thanks for taking my question. I have a question about the healthcare setting mask mandate and also the vaccine mandates for educators and healthcare workers. So for those three, does the state plan to lift them? And if so, at what point, either specific dates or specific metrics that you'll be looking at for deciding that?
Thank you, Fedor. This is Dean Salinger. I'll take that one. At this point in our response to the pandemic, those remain 3 critical tools we have to combat what's in front of us. Again, individuals with chronic conditions who are most vulnerable to complications from COVID seek care in our healthcare settings, as do individuals with COVID-19 themselves. We know that providers in those settings have been exposed more than individuals in other settings. So universal masking in those settings makes sense to help provide a higher level of protection so that everyone can safely access the care that we all deserve. Similar argument for mask requirements in healthcare settings and in schools are vaccine requirements in healthcare settings and in schools. Vaccines are incredibly safe and effective against COVID-19. While it is possible to have a breakthrough infection, the risk of getting sick from COVID-19, if you're up to date with your vaccines, is much lower than those who are unvaccinated, and the risk of hospitalization and death is even lower. So vaccines provide a critical tool to keep the workforce in those 2 settings safer from COVID-19, so that our healthcare providers are available to provide care to everyone who shows up for care, and so that our teachers and school staff can provide the quality educational experiences for students in classroom settings through the rest of the school year and as we move into next school year. So those vaccine requirements and mask requirements remain incredibly important tools, and we don't have a date right now to lift those.
So I hear what you're saying in terms of how the benefits. I'm just curious if you have an approach to deciding when you might eventually lift them, if you plan to, or if you are anticipating keeping these in place permanently. What is the thinking around that? Yeah.
I think we'll have to look at the virus that's in front of us, what it's doing in other states and other parts of the world, monitor for emerging variants. For the level of disease we have right now, it's significantly lower than it was months ago, and lifting mask requirements in general settings and in K-12 settings makes sense. But in settings where people go to get care for COVID and people who go to get care for those conditions that put them at risk for COVID, there's still a fair amount of COVID in our community, and having those mask requirements in place right now makes sense. We'll continue to look at the levels of spread in the disease, continue to partner with our other state agencies or OHA, with our federal partners on what recommendations are, but masks remain an incredible tool in those settings. At the same point, in K-12 and hospital settings, vaccine requirements did provide a very high level of vaccination in those settings. Those providers will continue to work, and as new providers are brought on, new staff are hired, they will have to meet that vaccine requirement. The hard work of setting up that system, monitoring the vaccines, tracking those who had an exception for vaccines have already been put in place. So we'll continue to use those systems to continue to ensure that we have workforce in those settings, at least for the time being. We know those vaccines will likely continue to remain incredibly effective. They work very well against Delta and Omicron, which weren't around when they were developed. We anticipate that they'll work against the next variant that comes our way. And it's important to have a productive workforce in those two settings when that next surge hits.
Thanks, Fedor. Next question comes from Kelly Ozer, KATU. Go ahead, Kelly.
Hi there. Can you guys hear me? Sorry about that.
Yep.
Okay, so a couple of questions for you. You've touched on all of them, but I just want a little bit more clarity if that's possible. I know that we acknowledge that we have been here before, being able to, stop using the masks as frequently as we have been. But then, of course, as you mentioned, Dr. Seidlinger, we had, the Delta variant come shortly after that. I know that you say we don't have anything on the maybe immediate horizon, but what is that protocol going to be for you guys going forward? Say a variant start kind of showing up again. How quickly are we going to be back to this? And will it be a statewide sweeping, put your masks back on, or will you leave it up to counties and various areas?
Thank you for that question. The same way that we've come out of some of these restrictions over time and gradually, I think will be what we'll see if we need any additional kind of recommendations or requirements going in the future. I think I can't make a blanket statement because we don't know exactly what the next variant will bring. We know that we will continue to do surveillance here in Oregon, that across the United States and across the world, there are surveillance programs in place that are looking for new variants or looking for changes in the way that the virus behaves. So if a new variant is discovered, what are the characteristics of that variant? How quickly does it spread? Does it cause more severe disease? Do the vaccines that we're currently using still protect against that variant? Do the therapeutics, whether it's our monoclonal antibodies or the oral antivirals that are coming into better supply, still work against that? Taking all those into account, seeing who's getting sick from that virus will help us to craft messages here in Oregon. We might initially talk to individuals who are at higher risk for complications, those who are older, immunocompromised, have underlying conditions that put them at greater risk, that they may consider changing their behaviors, putting on their masks, maybe limiting some of their gatherings. Those of us who are caregivers or live in a household with someone who has those may consider changing our behaviors. That if it's causing more severe disease across a broader population, that we may ask the general public to consider making some of these changes themselves. And then last step would be implementing processes in place that in certain settings, potentially that serve more vulnerable individuals, there might be mask requirements or other things in place, and then move on to a broader statewide piece. We'll take all the information that's in front of us, see what the virus is, see what the tools we have are, and make our recommendations based on that. And there will likely be a gradual set of recommendations to requirements, depending on what is in front of us and how it's behaving here in Oregon. Director Allen?
Yeah, let me just add a little bit to that. I think the response to the Omicron variant is a good illustration of how you might see things play out. If I remember the dates correctly, the Omicron variant was announced and identified the day before Thanksgiving, and within a very short period of time, we had what turned out to be worst case modeling from OHSU of the impact on hospitalizations. And an agency plan within about 2 weeks, I think, of the time that the variant was first identified, based on, not a whole lot of data from just a handful of countries. And so I think through the response to Omicron, we've developed the capability to really be able to identify a threat and act on it very quickly. You asked the question about whether we would take statewide action or wait for local action. I think it's hard to speculate what would happen in circumstances that we're kind of making up a hypothetical now, but I would say if we become aware of what looks to be a threat to hospital capacity, we know that that's a statewide resource, not an individual community resource. And so it's unlikely, if we think that that resource is under threat, that and we think actions need to be taken, that we would wait for local actions and not take statewide actions under the threat of that kind of a threat to the statewide resource.
I appreciate you both tackling a little bit of a crystal ball question there. So thank you. My last question, if you don't mind, is just about, we've talked a lot over the last 2.5 years about living with COVID and hopefully getting to that spot where COVID is a little bit more like the flu, if you will, that we can kind of exist with it in safe ways, hopefully. Are we to that point yet, or are we still kind of in a waiting period for that?
I think what we tried to capture in the RISE plan is the notion that we're not to a place where COVID is endemic like flu. I think when a lot of people talk about we need to learn to live with COVID, for some people that's code for we need to start ignoring it. And I don't think we're certainly at that kind of a place. It continues to provide a serious risk to certain populations, certain communities, people in certain living settings, and we need to continue to respond to that risk and minimize the impact. And so things like the maintenance of the masking requirement in healthcare settings, including long-term care, vaccination requirements for staff in those settings are the kinds of things that we don't typically do with flu. But that COVID continues to be a significant enough threat that we do need to continue to maintain that kind of vigilance that is a little bit different, particularly again for those who might believe that living with COVID means not doing anything in particular.
I'd just like to add to that. Thank you, Director Allen. I think, being endemic or living with COVID implies a little more predictability than we have now. We're approaching a grim milestone in Oregon of nearly 7,000 deaths with COVID. The country as a whole is approaching a milestone of nearly 1 million Americans who died with COVID, and those are huge numbers. A large portion of those happened due to the most recent variants, due to Omicron and Delta and the surge that they caused in disease. So, we need to kind of continue to monitor to see what emerges next. We need to continue to vaccinate Oregonians. Our colleagues in other states are vaccinating residents and folks in their states and getting vaccines out across the world to try and slow the spread of disease overall, to limit the possibility of potentially new devastating variants so that we can get to a place where this is more predictable and where we can live with it and where we have steps that individuals, communities, and the broader state can take to protect the most vulnerable, and so that we can come through this without the tragedies we've seen over the last 2+ years.
Thanks, Kelly. Last question is a follow-up question from Lynn Terry at Capital Chronicle. Go ahead, Lynn.
Yeah, good, I'm unmuted. Just a quick, I have a question for Colt Gill, but a quick follow on to Fedora's question about vaccinations. What about the executive branch? Is the requirement for them, is that going to be lifted? If so, when?
Thank you for that question. The current vaccine requirement for executive branch employees at the state came from the governor's EO. And so that will go away on April 1st. We still encourage all state employees, as we do all Oregonians, to be up to date with their vaccines. It offers us the best protection. But as we move forward, that will be lifted, but we'll maintain the Oregon Health Authority vaccine requirements in healthcare and K-12 settings.
Okay. And the other question, just a quick question for Colt Gill. You mentioned that some school districts have extended out the mask requirement. Can you give some details about that? I'm not an ed reporter. I don't know which districts you're talking about. So if you could just give some information, that'd be terrific. Thank you.
Yeah, thanks for that question. I don't have district by district detail. There's no requirement for local school districts to report to the state about their mask decision. I'm aware through various school board announcements or school district announcements. So there's at least one in the metro area, and then there are some on the other parts of the state that actually take spring breaks at different times that have extended their masking decision for a while.
So are you talking about Beaverton or Portland?
No, both of my understanding, both of those districts have decided to make masks optional beginning Monday.
Okay, so what you said, one in the metro area. Who are you talking about?
Let me be able to get back to you with that. I believe that it's Reynolds School District, but let me, before you print that, let us go back and double check.
Okay, thanks.
And then, Jonathan, do you want to?
Yeah, I think that's the end of this media availability. Thank you all for joining us today. Again, we have posted a link to our YouTube channel in the chat of this Zoom, where the recording of this availability will be posted afterward. If you have any other questions, make sure to direct them to the OHA COVID media inbox, orcovid19.media@dhsoha.state.or.us. Have a great rest of the day. Thank you.